Sjögren's disease is one of the most overlooked and misunderstood autoimmune conditions. It affects millions of people of all ages, and many go years without ever getting a clear diagnosis. I'm Dr. Adam Barron, and in this video, I'll go over 9 signs of Sjögren's disease and why they shouldn't be ignored. Sjögren's can start with symptoms as mild as dry eyes or fatigue, but in some people it can progress to nerve damage, lung disease, or even cancer. The sooner you recognize it, the better chance you have of improving your health. Sjögren's often begins with what feels like simple eye irritation, but this isn't dryness from seasonal allergies or looking at your computer for a long time. People with Sjögren's may feel like there's sand in their eyes. They may blink constantly, rub their eyes, or use eye drops several times a day, yet nothing seems to help. This is because the immune system attacks the lacrimal glands, which are the glands that produce tears. Over time, this can lead to corneal ulcers, infections, and long-term vision damage. If you need artificial tears constantly, or wake up with your eyes stuck shut, that's a sign to get checked. Saliva is essential for more than just moistening your mouth. It protects your teeth, helps you swallow, and even starts digestion. In Sjögren's, your immune system targets and attacks the salivary glands. This causes your glands to make less saliva. This leads to dry mouth, bad breath, a burning sensation on the tongue, and difficulty chewing or swallowing dry foods. One of the biggest red flags for possible Sjögren's disease is an increase in dental cavities, even if you've had good oral hygiene. Dentists are often the first to notice something's wrong. I've noticed that some patients I see bring a big water bottle to their first visit. If I notice that they are constantly drinking, this may be a clue to me that they may have Sjögren's. The third sign is fatigue. In Sjögren's, it's not just feeling worn out. It's a deep, unrelenting exhaustion that doesn't go away with sleep or caffeine. It can feel like you're walking through molasses. Some patients describe it as a feeling like they have the flu every day. It interferes with concentration, memory, work, and social life, and can lead to frustration, anxiety, and depression. If you're exhausted for no clear reason and it's affecting your daily function, then you should see your doctor. Sjögren's can mimic early rheumatoid arthritis with inflammation in the joints, especially in the fingers, wrists, and knees. This pain tends to be worse in the morning or after periods of rest. You may notice stiffness that lasts longer than 30 minutes, difficulty gripping objects, or mild swelling. Unlike osteoarthritis, which is usually associated with aging, this type of joint pain is autoimmune and affects people of all ages. In Sjögren's, the immune system mistakenly attacks your joints. If you're having persistent joint pain that limits your movement, don't just assume it is because you're getting older. The fifth sign is swollen salivary glands. Have you ever felt swelling near your jaw or just below your ears, especially during meals? This could be your salivary glands becoming inflamed or even blocked. The parotid glands are the most commonly inflamed salivary glands in Sjögren's. These episodes may be painless or slightly tender, and they often come and go. This causes many people to easily dismiss these signs. Ongoing salivary gland swelling, especially if combined with dry mouth, is a major warning sign for possible autoimmune activity. Sjögren's can also show up on the skin. Some people develop rashes, red or purple spots, or ulcers due to inflammation in the blood vessels. This is a condition known as vasculitis. Others may notice extremely dry, flaky skin. Some people can have hives that keep coming back. In other people, the blood flow to fingers and toes could be affected, causing color changes, cold sensitivity, or uncommonly tissue damage. This is called Raynaud's phenomenon. If your skin is reacting in unusual ways, especially along with other autoimmune symptoms, it may be part of a bigger issue. The seventh sign is lung problems. Sjögren's can silently damage the lungs, leading to a condition called interstitial lung disease. This is when there is inflammation and scarring in the lung tissue. This may first appear as a dry cough that doesn't go away, mild chest pain, or difficulty catching your breath during normal activities. Over time, this lung scarring can lead to permanent breathing problems. If you're having any of these issues, then you definitely need to get checked by a doctor. Sign 8 is peripheral neuropathy. Sjögren's can affect the nervous system. This typically causes symptoms like numbness, tingling, burning, or shooting pain, especially in the hands, feet, arms, or legs. It may feel like your shoes are too tight when they're not. In severe cases, it can lead to muscle weakness and balance issues. And the final sign is an increased risk of lymphoma. Sjögren's disease carries a real risk of cancer, especially non-Hodgkin's lymphoma. Studies show that about 5 to 10% of people with primary Sjögren's will develop lymphoma during their lifetime. That's significantly higher than the general population. What are some warnings? These are swollen lymph nodes that don't go away, unexplained weight loss, night sweats, and severe worsening fatigue. The risk is also elevated in people who have had Sjögren's for many years, or those who show specific warning signs. These signs include persistent salivary gland swelling, low C4 complement blood test, positive cryoglobulins blood test, or monoclonal proteins in the blood. While lymphoma only develops in a minority of patients, it is one of the most serious complications of Sjögren's. This is why regular monitoring and prompt diagnosis are so important. If this video helped you, give it a like and subscribe for more doctor-related health content, and share it with someone who might need it. This video is not medical advice and is only intended as educational information. Thank you for watching, and I'll see you in the next one.